We continue our coverage of healthcare systems all around the world. We're examining public healthcare systems to see what we might learn. Tonight, it's the state of healthcare in Sweden. Sweden ranking 5th in a European survey of healthcare quality. The life expectancy, by the way, in Sweden is 81 years. That's 3 years more than in this country. All in Sweden, by the way, are covered, and the level of care in each instance is identical, regardless of financial standing or whether or not you work for the government. Kitty Pilgrim has our report.
In Sweden, people go to a publicly run healthcare center for all medical needs. The clinics are run by the 21 separate counties in Sweden. Doctors work on straight salary for the clinic. Richard Salzman has been studying and working with the Swedish healthcare system for 25 years.
Overall, it's a very effective system. The Swedes consider it to be one of the best in the world.
The statistics are impressive. Life expectancy of 81 years versus 78 in the United States. Sweden's healthcare costs are 9% of GDP, less than the U.S. 16%. Per capita spending, half at $3,323 versus $7,290 in the U.S. And there is one doctor for every 277 people, compared to 1 in 416 for the U.S. Out-of-pocket expenses are low. They are capped at $400 a year. But people pay 14% income tax to the counties on top of national income taxes. The total tax burden is above 50%.
From an individual perspective, you do not pay when you get services. Where you do pay, of course, is in the structure of taxes, which is the highest in the OECD, the highest amongst the developed countries.
The health coverage is very generous. Women receive a year and a half of maternity leave at 80% of salary. Also, people can take paid sick leave, at first through their employer, and after 2 weeks through various government funds. Bianca Frogner has a PhD in health economics and has studied Sweden extensively.
In Sweden, they believe that sickness should not be a punishment, and that if you are out of work due to an illness, they do compensate you partly for your income that's lost during that illness.
New arrivals to Sweden and immigrants are all covered. Politicians and paupers get identical medical care.
That is a point of pride in Sweden, that a wealthy industrialist or an elected official gets care in exactly the same facilities from exactly the same doctors for their clinical needs. There are no differences between citizens.
There are downsides. Sweden has problems with waiting lists for elective surgery and other non-critical treatments. There is also a public push for more individual doctor choice. Now, Sweden is trying to improve the doctor-patient relationship, trying to link doctors to individual patients. The impersonal nature of the system has caused some discontent in Sweden. And also another issue going forward is a fifth of the population is over the age of 65, and that will start to put pressure on health costs in the future. Lou?
Yeah, it's something that won't happen in this country for at least, what is it, it's about 15 years, 15 to 20 years. But I mean, people have got to be watching that report thinking, my God, 80% of pay for a year and a half for maternity leave? You know, that's pretty good.
It's very attractive, but the taxes are very high, so it's...
And what are the taxes in
It's
Sweden?
about 50%.
Just about 50%. Well, you know, there's no such thing as a free lunch or free maternity care, I suppose. Maternal leave, I guess we would call that. After a year and a half, that's really leaving, isn't it?
And the job is guaranteed that you come back.
All right, terrific. I can see women all over the country thinking,
let's move to Sweden.
All right. Well, I was thinking of something else, move to Sweden here. Thanks a lot, Kitty Pilgrim. We'll continue our coverage of healthcare systems around the world. We'll be reporting tomorrow on healthcare